Could you please show everybody where is your knee pain? Like here? Here?
Yeah.
Okay, do you feel it right now?
Yeah.
Even seated, or you need
Yeah.
to move it? Oh, both sides?
Yeah, both sides. No,
Okay.
This is worse.
This is worse. Okay. So you just feel it like when you do this, you feel it?
Yeah.
Okay. Okay, then I'm going to ask you. Okay, and this one. Okay, now. Sorry. Relax, smile. Okay. There, is it tender when I push? Yes? Okay. So I'm putting a needle on the large intestine 11. Close. Bye.
Yeah.
Yeah. Okay. Another one on the large intestine, a little bit more distal.
Yeah.
Yeah, also.
Ooh.
No.
A little bit.
Little bit this one. Now I'm on the Senjao. So a little bit distal to Senjao 10. This one. Okay. Okay. Now I would like you gently, you just move your knee and this one also. Okay, and you tell me where do you feel the pain?
Still here, but 20% less.
20% less, this
Feel,
one?
Feel it soothing.
Okay.
Yeah.
This one, how
This
much
one.
less?
Just 10%.
10%. Okay. Can you show me where is it? Here. It's a, how big is the area?
It's about that.
About that?
Yeah.
This coin like this?
Yeah.
So it's what, $1 Australian
yeah,
dollar
yeah.
coin area here?
Yeah.
Okay. This one. Okay. Now, can you do another gentle, just to, yeah, just to, not all the way, just a little bit. Yes, very good. Now you can do all the way. Okay. And now you tell me, where do you feel?
Not still here, but 50%.
Very good. This
Yeah,
one.
soothing.
Also, soothing also?
This is about the same.
Okay, can you show me this one? Where is it?
Same area.
This finger? You're showing, and this one is where?
There. Same.
There. Okay. Not here, right? Here.
No, here too, but bit
Oh, here also.
also.
Oh, so it's not
And
just.
But it's just more on the bone.
Okay. Let me just try to reorientate this one. Okay. Now you try to move the two of them also.
Oh, this is much better.
Okay, very good. Now we check this one.
Sort of halfway.
Halfway, now we get 50% on this one too?
Yeah.
Okay, very good. Let me give you a little bit more on this one. Just reorientate a little bit. The same needles. Okay, now you try again this one.
Yeah, 30%. 30% more. This one.
Okay, so now, so 50 plus 30?
Yeah.
Okay, so now it's 70?
80.
80. Sorry, thank you. No. So 80 here and about 80 here too?
Yeah, but this is heavy.
Heavy, this
one's heavy.
heavy means it needs to continue clearing. So that is okay. But the pain that you were experiencing is?
Pain's good.
Pain is good.
Heavy.
Okay. Heavy, it means it needs to continue working a little bit. So I let you cook with the needle.
Yeah.
Is it okay?
Right.
Okay, very good. Give me 5. Actually 10, it is too neat. Thank you.